So we're really worried. There are a number of places, particularly in London and around the Thames Estuary, sort of North Essex and the Kent area, where there is an enormous amount of COVID. And if we've learned nothing else from the first wave of the pandemic, once this starts spreading, it'll spread very quickly to wherever it goes. So we're all worried about the workload that this is going to cause. Everybody's seeing much more COVID, and it feels like we're back at the same levels of activity that we were in the spring. We were able to do a lot of things back in the spring that we aren't doing now. So we emptied our hospitals and a lot of people went into care homes. We cancelled a lot of surgery, important stuff that needed to be done. And so we suddenly created a lot more capacity in our hospitals. That's not happening to nearly the same level at the moment. And you can see the consequence of this is we've got lots of sick people coming into hospital. Our intensive cares are frequently very full. And the end result is that the hospitals are full, so the emergency departments get full, and then we can't offload ambulances. And we've seen all these really distressing images of ambulances waiting outside emergency departments, waiting to offload. People are more burnt out than they've been for a long time. I mean, winter and the early parts of the year, January and February, are always tough to work in emergency departments. I think the difference is now people have had a very disrupted summer. I think it's very short-sighted to ask people to cancel leave. All you're doing is storing up problems for the future. We can see a manifestation of burnout, that sick leave is probably considerably higher than it's been for a while. Now, part of that is because of self-isolation, but some of that is that people are just a bit broken.